Welcome people. In this video we want to look at pre-anesthetic medications. So what exactly do you mean by pre-anesthetic medications? See, before giving anesthesia you will have to give some medication so that the anesthetic procedure is going to go very smoothly. You understood, right? So first of all, they evaluate a patient for anesthesia. Is the person eligible to get anesthesia? A chest x-ray, a routine, a sugar monitoring, blood clot monitoring, all that is done. And then if the person qualifies for anesthesia, then what they do, they give pre-anesthetic medications to make sure that the anesthetic process goes smooth. Okay? So they want it to be smooth, they want it to be safe, and they also want it to be more pleasant for the patient and themselves. Okay? So let us see what exactly are the objectives. Okay? So basically, what and all you think will happen during anesthesia? A patient might be very anxious. The patient may have excess salivary secretions which you don't want because you want to have endotracheal intubation. So you don't want excess salivary secretion. Some of the anesthetics may produce salivary secretion, so you don't want that. Then the patient obviously will have pain, correct? So you want to remove this pre and post operative pain. The patient may have emesis. We don't want the patient to have emesis, that is vomiting. You don't want the patient to have excess gastric acid secretion. You don't want them to get into any stress ulcer. And then you don't want them to have any aspirational pneumonia. See, aspirational pneumonia is not a very common thing. But in surgery, etc., what happens, because the acid in the stomach may get aspirated, okay, to the lungs, then it can lead to pneumonia. Okay, so that is where they are trying to avoid all these. So this is what you want to avoid. These are the objectives of pre-anesthetic medications. Okay, let's get into the details now. Okay, so what are we studying? We are reading pre-anesthetic medications. We know what we want to avoid, what are the problems we are expecting, we know. Now we have to find a solution for those problems. Okay, very good. Now anxiety. Now how do you prevent anxiety? Give anti-anxiety medicine or anxiolytic, sedative, hypnotic. What will those be? Diazepam, lorazepam. Okay. So what are these drugs? They are benzodiazepines. Correct? How do they act? They act on the limbic system. They bind to the GABA receptors, which is inhibitory. So there will be less signals, right? Hence there will be less anxiety. You understood? Very good. What did you understand? We'll give diazepam and lorazepam as anti-anxiety. Very good. Now let's move on. If we want to prevent, so basically the problem here is bradycardia and salivary secretion. So if we want to stop bradycardia, that means, and we want to stop salivary secretions, then you will have to give an anticholinergic drug or an anti-muscarinic drug. Example, glycopyrrolate atropine. Now, how do these work? They work on the, M2 receptors are actually inhibitory, correct? So M2 receptors are inhibitory. These will get blocked now. These will get blocked. Okay. That's the whole point. You want to block the M2 receptors. That's how they prevent bradycardia and salivary secretions. This much you understood, right? Do you want us to read any data? So they also prevent laryngospasm. So they also prevent laryngospasm. Okay, laryngospasm is prevented by reducing respiratory secretions. They reduce respiratory secretions. Okay. So glycopyrrolate is preferred because it is more potent. It does not cause any CNS side effects and also causes less tachycardia. Okay, glycopyrrolate is the preferred one. Glycopyrrolate preferred, diazepam preferred. So these are your actual pre-anesthetic medications. Okay. Less effect on CNS, less tachycardia are the advantages. So now let's move on to the next problem. The next problem is pain. Now how will you manage pain? So you can give either morphine and diclofenac. Based on the type of pain you can decide. Okay. Morphine is an opioid analgesic. It will bind to the opioid receptors like the mu, kappa and delta receptors. So these are the mu, kappa and delta receptors. What will they produce? They'll produce spinal and supraspinal analgesia. Okay. So what happens? You can also give diclofenac, which is an NSAID. It's actually a preferential COX-2 inhibitor. Okay. Preferential COX-2 inhibitor. So now currently where we are here, we are looking at pre and post operative pain. Opioid analgesics such as morphine, pethidine, fentanyl may be used to relieve pain. The limitations with opioids are respiratory depression. So there's a problem here that you should expect. So disadvantage is respiratory depression can happen. Okay. What are the other options? Pethidine, fentanyl. Okay. If you remember, in the general anesthetics classification, inhalational intravenous, we have seen in slow acting intravenous, we have seen opioid analgesic fentanyl. Interesting, right? Fentanyl they are saying is also a general anesthetic. So anyways, we are here. So opioids, if you give, you should expect respiratory depression, hypotension, nausea, vomiting, constipation, bronchospasm, etc. can happen. So even diclofenac can be used. It is an NSAID, preferential COX-2 inhibitor. For very minor type of pain, you can use diclofenac. Emesis. Now, emesis is a problem that you are expecting. So, how will you handle emesis? Obviously, with an antiemetic. Antiemetic example, ondansetron, metoclopramide. How does ondansetron work? It is a 5-HT3 antagonist, serotonin antagonist. Antagonist is it is going to inhibit the action. Alright. So it is an antagonist, 5-HT3 antagonist. Metoclopramide is actually a prokinetic drug. It hastens the gastric emptying. So obviously emesis effect will be less. Okay. So what did you understand now? For an antiemetic effect, you will give ondansetron, metoclopramide. They may be used to control vomiting. Acute dystonias and extrapyramidal symptoms, EPS symptoms, are the main side effects of metoclopramide. So, as metoclopramide has some side effects, okay, hold on, let's make another row here. How do you make another row? Insert a row below, okay. Bring this metoclopramide here. See, metoclopramide is a prokinetic drug. It can also be used as antiemetic. But the problem with this is disadvantages are EPS effects. Extrapyramidal side effects are more. Okay. So what are these extrapyramidal side effects? Like Parkinsonism, acute dystonias, right? You remember all of them? Dystonia, akathisia, Parkinsonism, right? You remember all these words? Dyskinesia, etc., right? So the disadvantages of metoclopramide is given here. So you will actually prefer ondansetron. Don't write wrong spelling. Ondansetron, okay. Then you have continuing. Now we want to reduce the gastric acid secretion. We want to reduce stress ulcers. So the problem here is gastric acid secretion and stress ulcer. So the solution is ranitidine. So ranitidine is also a pre-anesthetic medication. What does ranitidine do? It's a H2 blocker. So it is an antihistaminic drug, right? Antihistamine it is. And it is a H2 blocker. So it will make sure that gastric acid is not produced that much. And you can prevent stress ulcer. Another good option is omeprazole. Omeprazole, you know, it is a proton pump inhibitor. Just look at this diagram from K.D. Tripathi. You will be able to understand what proton pump inhibitors do. This is a proton pump inhibitor, correct? H plus K plus ATPase. This is inhibited so that finally acid is not produced. So ranitidine and all are very one type of action like histamine. Only this. But if you look at proton pump inhibitors, they will, in the last level, they will stop acid production. So they are very, very effective. Okay. So omeprazole, ranitidine. Okay. These can even prevent aspirational pneumonia. Okay. Coming to gastric emptying before surgery to prevent aspirational pneumonia. So basically gastric emptying you want. Full stomach. You want to prevent this. Or aspirational pneumonia you want to prevent. So you want gastric emptying. This is what you want. So for gastric emptying you will give metoclopramide, domperidone. Both of these are what? Prokinetic drugs. Okay, both of these are prokinetic drugs. They increase the tone of the lower esophageal sphincter. They accelerate gastric emptying towards the intestine, correct? So here they increase tone of lower esophageal sphincter also. Okay. They also increase the tone of the lower esophageal sphincter so that there will be no regurgitation, correct, from the stomach to the esophagus. So prokinetic drug it is, it will actually hasten gastric emptying, so towards the intestine, so that you can prevent aspirational pneumonia. Okay. So guys, we are done with all the drugs for pre-anesthetic medication. See, the whole idea that they ask you this question is that in one question they can get lot of drugs, lot of mechanisms. Probably that's why one of the favorite questions in exam is pre-anesthetic medication. So just imagine you can cover like all chapters, central nervous system to anticholinergics to opioid analgesics to gastric acid, peptic ulcer chapter to antihistamines to so many chapters they can cover off in one question. Okay. So we are going to close this video now. Say bye bye. Bye bye.